Josh can edit it, so it's going?
Yes.
All right. Hi guys, this weekend we're finishing out with Lise, who traveled here from Georgia, Athens, Georgia. She came here on Thursday evening. We took a cast of her residual limb to try to transition her from her current setup, which is a direct socket that Össur is doing with a flexible top, and she wears a Sealant V or a Sealant X5 liner. The reason why she's here is because she was having some issues with her prominent distal femur, dealing with after about a 5K of walking. She'd have some bone pain. She even presents with some callousing when she first came here from this current setup and trying to become more active. And she deals with some blistering on the lateral distal aspect of her femur as well. And so the reason why she's here is she wants to become a runner and start running with her kids. She used to run before her amputation, so her goal is to try to get back to doing that and also preserve the health of her residual limb, because after a 5K she deals with blistering and bone pain. And so we're just trying to improve the setup she has in her current prosthesis so she can be as active as she wants to be and not have any limitations. And so with this current setup right here, you know, in our practice here, we use some subischal sockets, but for running at a transfemoral level, this does not provide the amount of coronal plane stability required to allow them to have their muscles work efficiently and be stable when they're running. It also does not allow stability of this femur to prevent from kind of translating lateral and distal whenever she's running or walking at a high rate of speed. So we changed up the socket style to a ischial containment socket, and we're trying skin fit suspension with her. So she actually pulls in with a darning chute that she puts on her residual limb and pulls into this socket. And so we took her out of a subischial liner when she was having some sweating, some callousing, some blistering on the bottom after long periods of use, and we're transitioning her to a skin fit suction socket. And so the purpose of doing that is, one, to kind of eliminate some bulk, some weight, eliminate the use for liners, and reduce the sweat, but also allow her to run and have a good suspension method that will provide her stability and increase proprioception that she does not currently get with her current prosthesis and liner setup. So as you can see, this is her current socket. This is the posterior aspect, lateral, medial, and anterior. So not a lot of anatomical modifications have been done to this. In subischial socket designs, I'm confident that there's a principle called hydrostatic loading. I'm going to touch your leg. Hydrostatic loading essentially takes the tissues and loads them uniformly to compress the skin and also provide suspension. But as you can see with Lise here, as you load her tissue, that distal femur becomes more prominent. So hydrostatic loading in a subischial system is a nice, easy way to make a prosthesis, and it's comfortable because it's not as high of trim lines. But in her particular case, I almost feel like the hydrostatic loading is exacerbating her problem of having a prominent distal femur. And so this femur does not have a lot of soft tissue coverage just because some of this muscle or tissue over time has slipped off with this bone. And so we went out of a subischial style that incorporates hydrostatic loading to a skin fit ischial containment socket style. And as you can see here, this is kind of her ischial containment socket, posterior, medial, anterior, lateral. So just a bunch of different trim lines, higher trim lines encompassing her anatomy. And so in this particular socket, we're promoting axial loading through her ischium. So all 105 or 10 pounds of her should be loaded through this ischium to prevent bombing out on this bottom femur here. We did accommodate this femur with the socket style by incorporating a void between the flexible inner and the frame. So as she is walking or gets to running, you know, there is a little bit of play in the flexible inner and frame that could allow some migration of the flexible inner in the socket to decrease pressure if she were to occur just from normal limb atrophy or shrinking or sweating as she's running. So we did accommodate for this femur. This is a whole new setup, going from a liner subischial socket to a skin fit ischial containment socket style. And so she's been trying this for the last 2 days, acclimating to the fit and the donning process. Oh, as you can see, she has this vertical shank all-pro foot, and she's coming out of a lower profile Össur foot. So these are good walking feet, but for people who are trying to walk on uneven terrains, vary their cadence, become a little more active, we actually mailed this to her, and she's been trying this for a couple months. And what are some differences you notice about this foot compared to your old foot?
when I have the new foot on, the sports foot, it feels like I'm standing on a trampoline. I can just go. There's some momentum and some leverage to go. This feels like I need to go slower.
Right, so would you say this foot, the sensations you get, you enjoy better than this foot?
Yes.
Okay, just because it has more movement to it.
Yes.
And so they use a low profile foot, but as you see, her residual limb is not short, it's not long, it's kind of mid-length. So she has clearance for a foot. So we actually mailed this foot and we're able to install it on her existing prosthesis with her Rio knee and her socket. So a lot of times just upgrading the foot can improve shock absorption, which has decreased some pain on the distal end of her femur, just because, like she said, it's kind of like walking on a trampoline and absorbs shock. This does not offer a lot of shock absorption. This is a nice smooth walking foot, but with little shock absorption. And for her socket style, she needs extra components to absorb the force that's going to be imparted on her femur. And that's another reason why we went with the ischial containment, because the ischial bone is a pressure tolerant bone, and we want to be able to load this. This femur is not a pressure tolerant bone. And so right now she's being suspended doing that, and she gets some pressure down in there. So whole different setup, whole different suspension. Today we also put her in a total knee 2000. The reason for doing this is just to work on some a polycentric knee unit kind of forces you to walk a certain way and improve your gait mechanics. We use a lot of computer knees as well. They're really smooth walking knees, but they're a little bit heavier. And as she's transitioning to this running blade, and we're using a polycentric running blade, running knee for running right now, this walking knee and the mechanics required to activate this knee will translate to this running knee. So we're allowing her to kind of use her muscles in a different way, her hip flexors, and also some of her gluteus maximus extensors to kind of stabilize her prosthesis walking with this knee, and also which will translate to this running knee. Because going from a single axis microprocessor knee where it's kind of doing some of the work for you and offers a lot of inherent stability, you don't have those fancy features when you get to running with the running knee. So we want to start developing some different habits and different ways to use your muscles walking every day that will translate directly to running. And so we were able to get into a slight jog yesterday, but it's definitely a learning curve with someone's never ran before. So she's actually she's all set up to take these two home, swap them out by turning a screw and threading them on, and begin her training process. So lastly here, Lise, can you define anything that you've noticed about this socket style and this suspension system compared to this one that you might have noticed the differences that you're feeling compared from this one to this one? Just a couple things you've noticed. Walking on this and then walking on this.
Yeah, when I was walking on this and I went back to this one, it felt like I was really working hard just to kick my leg forward and walk, because it felt very heavy in comparison to what I felt there. So I'm hopeful that, training muscles, just going through my daily activities to enhance running is going to be perfect. That's what I need to get stronger muscles so that running is easier. This is obviously completely different to what I wore the last couple of months. So but I feel like my body has already adjusted to this. I realized that I need some support here on my sitting bone, and that's what I felt. But it's a good sensation. It feels secure. What else?
So a couple other things too is that this is the side of her current setup. There isn't a lot of flexion or offset built into her setup here. She does not measure for a flexion and contracture. And also in the coronal plane, there isn't a lot of adduction or lateral offset. So when we first put this on, she immediately felt some varus going on of her residual limb when she was walking compared to this one. We incorporated some adduction, a little bit of offset, not too much, and then also in the sagittal plane, some flexion with a little bit of offset as well, just to allow her to really get over this blade and use her muscles more efficiently when they're kind of aligned. When the prosthesis is aligned, they can allow her muscles to work more efficiently. So those are the differences that we did. She's leaving today to drive back to Georgia, and then we're going to keep following up with her virtually, and then we'll be seeing her again, down the road to keep checking her progress and keep fine-tuning things as things come about. There is one last thing I'm going to give you, so you're part of the official ABR family. For her struggles of going to a very non-intimate, loose-fitting socket to a very intimate socket and spending this time with me, she gets a nice medal, and she's part of the family now. All right, so looking forward to get you going. Appreciate you driving all the way here, and we'll talk to you again soon. So thanks again.
Thanks.
Okay, all right.